we're going to talk about how the heart works, what's atrial fibrillation, the connection between atrial fibrillation and stroke, and what treatment options there are to basically prevent stroke. I would like to have participation from folks. This is for you guys to ask questions and for me to hopefully answer your questions and make things clear. These are my opinions. The talk belongs to me, so that's a disclaimer. I'm an interventional cardiologist from Cardiologist Heart and Vascular. I go to 3 offices, and that's my number. I work out of 2 health systems, and my specialty is in structural heart disease and complex coronary interventions. So let's talk about atrial fibrillation. Atrial fibrillation is basically the conduction problem of the upper chambers of the heart. The heart has 2 upper chambers that are smaller and 2 larger chambers that basically pump the blood either to the lungs, the right heart, or to the rest of the body, the left heart. And this is a coordinated effort by the upper chambers and lower chambers. When the electrical component of the upper chamber becomes completely disorganized, the upper chambers don't contract normally, and that is what atrial fibrillation is, where there's completely unorganized electrical activity of the upper chambers, and that's why the blood stagnates and potentially blood clots form. And this is sort of an EKG criteria of it. This is a normal EKG, whereby you can see this P wave, which is the sign of electrical activity of the upper chamber, and then QRS, which is the electrical activity of the lower chamber. When in atrial fibrillation, this is lost. It's completely, instead of electrical activity starting in the top and going bottom, it comes from all over. And it's completely disorganized. And you can see that it's completely disorganized and it's going at different times through the lower chamber. The lower chamber does its job fine, but the upper chamber is out of rhythm. And this is a very common problem in the world and United States. There are millions of people having it. And as the graph shows, the numbers are going to increase as the population ages. It can impact the quality of life, especially if you have other issues with the heart, and people can feel it, and the exercise tolerance can go down, or sometimes people can completely be asymptomatic from it and not even know that they are in it. We usually categorize this as 3 forms: paroxysmal, persistent, and permanent. Paroxysmal is when it comes and goes. Sometimes you're in normal rhythm, but at times you go out of rhythm. Persistent is when you are in atrial fibrillation, but not for a long time, that you're consistently in it, but it hasn't become a chronic issue. And permanent is when it's chronic, and it's very hard to put the heart back into normal rhythm when you've been in atrial fibrillation for a long time. What causes atrial fibrillation? These are a few causes, but honestly, a lot of times it's a disease of aging. As people age and the atrial fibrillation incident goes up. Now, it could certainly be due to structural heart disease. People with mitral valve disease, tricuspid valve disease, can get atrial fibrillation, or with congestive heart failure. But many times we see healthy people who are 75, 76 years old, and they present with atrial fibrillation. It can be symptomatic. You can get short of breath. You can have a racing heart. A lot of times younger people, their heart rate can go quite high when they go to atrial fibrillation, and they can feel it. Or as people get older, maybe their heart rate doesn't go up as much, but it can cause other symptoms such as shortness of breath or dizziness or lightheadedness, or just fatigue. People just don't feel the same as they did when they weren't. As I said, a lot of times people don't even can be in it and not know it. So what is important about atrial fibrillation? People with atrial fibrillation are at high risk of having stroke because blood stagnates and clot forms, and then when the heart beats, clot can go out of the heart to the brain. Depending on other risk factors, the risk of stroke can be 3 times, 4 times, 5 times normal. And again, as I did go over this, there is an area on the side of the heart where we call left atrial appendage is a small pouch. That's where the blood stagnates most. And 90% of these blood clots form in the left atrial appendage in atrial fibrillation. And again, the clot can come out of the appendage, go through the mitral valve into the left ventricle, and through the left ventricle, an aortic valve up to the rest of the body, and potentially the heart, potentially the brain, and causing strokes. Of course, atrial fibrillation can also cause heart failure, especially if the heart rate is elevated and untreated. So I went through this again. Thrombus can form in the left atrial appendage, can travel through the heart, through the aortic valve, and all the way through the arteries to the brain and cause a stroke. We went through this, so I'm going to go a little bit fast since we already talked about it. So these are very important statistics, and they're eye-opening. 1 out of 3 people can have stroke if they're in atrial fibrillation, and again, as I said, 90% of these are caused from the left atrial appendage, the small pouch that is on the side of the left atrium. And if you have a stroke from atrial fibrillation, it's a lot different than if you have a stroke from a high blood pressure. It could be fatal. If a big thrombus, big clot goes to the brain, it can truly have either a significant deficit, or you end up with significant long chronic deficit, or even death. These are the signs of stroke. You have to act fast because if any of these symptoms occur, and you get to a place where they can potentially get the clots removed from the brain, or give medication to potentially break it, the deficits can become much less, or even completely resolved. So these warning signs should be taken very seriously and have to get to a hospital very fast. So what are the treatment options to prevent stroke? We have medications that traditionally we've been given, blood thinners. In general, we call them blood thinners, and that's to prevent stroke. There are old blood thinners, Coumadin, that everybody's familiar, and a few newer ones that we've had in the past decade, I would say, and they don't require people to basically, I'm sorry, I'm admitting new people since I'm also hosting, so bear with me. So there we go. So, and then the newer blood thinners that we give, and you don't need to check your blood regularly, as with Coumadin. And of course, on the other side, we can potentially get people out of atrial fibrillation by either changing their lifestyle. Obesity, by the way, is a big contributor to the risk of recurrent atrial fibrillation. Or there are procedures that our electrophysiologists can go and sort of burn the areas where atrial fibrillation might originate from. We have medications that we can give people to get the heart back into normal rhythm. And also we can shock people out of atrial fibrillation. So we talked about all this. I'm going to go through it fast because I want to talk about the new, relatively newer way of preventing strokes. So these are the two things that we have for potentially preventing strokes. Medication, as I talked to you folks about, blood thinners, and then the left atrial appendage closure device, which I want to dive into a little bit more extensively now. This is the pouch of the left atrium that I talked about, and by closing this, we can prevent blood clots from when they form to travel out of the left atrial appendage. So we talked about this. Warfarin is the old one, and we have a bunch of newer ones on the market in the past 10 years. But you know, the problem with the blood thinners is that people can bleed. So you have to really always weigh the risk of a stroke versus risk of bleed. And different people are different. You know, some people have different risks of bleed based on underlying health conditions that they have. For example, older people can be unsteady on their feet, at risk for fall. That's a big risk. Some people have health conditions that makes them bleed further in their stomach or other places. So that comes up, and when that comes up, in the past 10 years or so, we have another option, and that's to close the left atrial appendage. And closing the left atrial appendage is basically a effective way to reduce the stroke while prevent people from having to be on blood thinners for long term and bleed. So Watchman is the name of this plug that we put in the left atrial appendage. It's Boston Scientific is the company that produces it, and as I said, it prevents stroke as well as prevents long-term risk of bleed. It's for people who don't really deal with this often. It's staggering that, you know, so many people who go on blood thinners, specifically warfarin, go off warfarin because they have either non-compliance or they bleed. The good news is that in the clinical trials with Watchman, people were able to come off warfarin after 45 days effectively. And frankly, now with the new Watchman device, the new generation, they can even go on the newer medications by the guidelines and come off it in 6 weeks, 45 days. Watchman doesn't require surgery. Nobody does any cuts. It's all done through the groin. We go through the femoral vein, all the way from the right side of the heart to the left side, and isolate that pouch, the left atrial appendage, and put the plug in. We make sure that the plug is secure, that is occluding the pouch effectively, that there's no blood that can go around it. And once we make sure of that, we release it and come out. It's typically takes less than an hour. We do have an anesthesiologist who puts people under general anesthesia for a short period of time. People generally stay in the hospital overnight. We do an ultrasound in the morning, make sure that everything is fine, and people go home after that. So I went through this quickly. Again, I will go over it. We go from the right groin. We make a small hole where the catheter goes to the right side of the heart, and we isolate the pouch, put the plug, and patient stays overnight. We watch them and go home the next day. After 45 days, we do take patients off warfarin. Now, I have had patients in the past year, based on data that's available from outside the United States, who cannot take Coumadin or other blood thinners at all. And I have done patients on only aspirin and Plavix, which is another antiplatelet agent. So people are feeling more and more comfortable not even having to keep patients on blood thinners for 6 weeks, because a lot of people cannot take it at all. And that is could be a hindrance for this procedure. But in my experience, and I've done many right now, on only dual with aspirin and Plavix only, and not keeping them on blood thinners, and people have done well. So what are the risks with this procedure? You know, the risks, of course, the risks are it's bleeding in the groin. I mean, we go through the vein. The risk is, of course, bleeding around the heart when we do it, or the other risk is device dislodgement. These risks are extremely low, and you know, well under 1% in my experience. And it's, as far as procedures are concerned, this is a very safe procedure. Now I'm going to try to show you. Okay, let me see if I can play this.
This is the Watchman implant, a one-time procedure that may reduce your stroke risk for a lifetime. If you have atrial fibrillation not caused by a heart valve problem and need an alternative to blood thinners, you'll want to learn more about Watchman. You probably already know that atrial fibrillation, or AFib, increases your risk of having a stroke. In fact, on average, a person with...
I'm going to go forward because we talked about this for the sake of time and actually show you the actual procedure.
A large part of being an inventor is being creative.
I don't know what I... there we go.
Reduce stroke risk in people with AFib, not caused by heart valve problems. Watchman is the only implant approved by the FDA to do exactly this. This little device fits right into your left atrial appendage, closing it off so blood clots can't form there and lead to a stroke. If you have AFib not caused by a heart valve problem and need no...
I'm sorry, it seems like the video is not showing.
May be right for you.
If you have atrial fibrillation not caused by a heart valve problem and need an alternative to blood thinners, you'll want to learn more about Watchman. You probably already know that atrial fibrillation, or AFib...
Let me see. It seems like it did not play, guys. So I'm sorry. I'm just going to skip it because it did not go on it. And I don't want to waste time if we are going to have questions that I want to get to. So again, this is the only approved FDA device for this. And the wealth of the number of people who've had it actually is more than that now. Tens of thousands of people have received the Watchman and have done well. So the data is out there, and it's a fairly proven device now. So who's for Watchman therapy? If you have atrial fibrillation that's not caused by heart valves, that and there is major bleeding risk with blood thinners, or also people who are at a profession that puts them at risk for major bleeding. You know, for example, if I was a tennis player, I would not want to be on a blood thinner and potentially get hit by a tennis ball. Or if I was a ski instructor, or any profession that puts you at risk for potential major bleeding. So these are a few people that should not receive a Watchman. If you can, again, we talked about this, so I actually don't, I agree with this. I think if you cannot take blood thinners, but you can take aspirin and clopidogrel, which is another antiplatelet agent, like aspirin, you should, and I feel comfortable putting a Watchman in. If, of course, you're allergic to the material that Watchman is made of, and also if your that pouch, that left atrial appendage, is not the size that we can put a Watchman device safely in, of course, you're not a candidate. And then, of course, if you have to take blood thinners anyway for other reasons, then you have to stay on blood thinners. Again, it's covered now pretty much by all the major insurances. I have not had any issues in the past couple of years getting it approved from any major insurance. I am gonna skip this since we had an issue with the videos. A few numbers. This is our number for our office if you need to talk or get an appointment about a potential procedure. There are some sources that you can go and read more about it. And Watchman has its own website that you can certainly go and watch the video that I tried to play, and I guess it was not playing.